If you're like me, you just paid over $400,000 for dental school tuition, and now professors and colleagues are telling you to do a 1-year General Practice Residency, or a GPR. And the crazy thing about all of this is that the average salary of a GPR resident is almost equivalent to what a McDonald's manager could make. Hold on. Something does not make sense here at all. How is it possible to pay off student loans and live the life we almost spent 10 years of our lives trying to live? Is a GPR or AEGD really worth it in present day state of dentistry, or is it an absolute waste of time? In this video today, we will talk about what it really entails. Stay to the end and I'll give you my final verdict and tell you what I think is the best option to make sure you have the most productive and successful future, whether you choose to do one or not. Option 1, jump right into private practice or corporate. Option 2, pursue a specialty like endo, ortho, peds, or OMFS. Or option 3 is to do a GPR or AEGD, Advanced Education in General Dentistry. Now, all three options have their merits, and taking any one of these paths can lead you to a successful and fulfilling career. However, as the dental landscape continues to transform, it's crucial to evaluate whether a non-mandatory residency remains the best choice for aspiring dentists. To be quite frank, it's actually a really big differentiator between pursuing a career in medicine and dentistry, as our physician buddies are forced to spend a minimum of 3 years post-medical school in residency. While residency undeniably offers advantages like exposure to a wide range of dental and medical procedures, the opportunity to work in a hospital setting, and an extra year of mentorship, it is important to recognize that this unique package may not align with the specific needs and aspirations of every single new grad. And the idea for this video simply came to my mind after hearing my graduated classmates time and time again saying that residency was a big mistake and they wish they didn't choose that extra year of training. Now, I think it's important to approach this topic with an open mind, recognizing that formal education in general has come a really long way in the past decade. Let me pose a question to you. If there's a Zoom lecture online with the ability to pause and rewind, is anybody really going to class anymore? Maybe your experience is different than mine, but I encourage you to challenge the traditional pathway laid for you by the ladies and gentlemen who currently struggle to use Facebook properly. By challenging the conventional narratives surrounding residency, we could potentially save an additional year of lost income and experience in different avenues of dentistry. Let me start by giving you a brief story on my own journey. So I made the decision to start working immediately after graduation and dedicate myself to continuing education, or CE. By pursuing advanced CE programs to learn advanced concepts like occlusion, implants, veneers, one can effectively engage in a form of residency while also still getting paid as a full-time dentist. And these lessons are taught by world-renowned leaders in the dental field. Simply put, these teachers are more qualified than your roll-of-the-dice professors or instructors that you may get in your residency programs. So why waste valuable time in residency when you can directly learn from the key opinion leaders in the field? For those motivated to expand their skill set beyond what dental school offers, you can pursue the specific CE course curriculums you want to become the dentist you want to be. I have friends who wanted to learn ortho, and now they're starting to place bracket and wire on class 1 malocclusion cases 1 year after coming out of dental school. I personally am a surgically driven dentist, so I created my own OMFS rookie starter pack with a 7-month implant continuum, coupled with a few impacted wisdom tooth extraction courses. You see, this is how I tailored my CE to bring my own vision to reality. Nevertheless, working right out of school allows you to hone on your skills much faster, in my opinion. I always felt that when I had a crutch in life, I never truly got a good hold on things until I was completely on my own, forced to find creative solutions. In these moments, the information just stuck more with me. And doing this in your first year will increase your professional marketability and will most likely garner you a higher compensation for your advanced skill set in all your future opportunities. And guys, I understand that everybody moves at their own pace. If you genuinely feel unprepared and believe that another year of training is necessary, pursuing a GPR is absolutely acceptable. I'm here to give you different perspectives so you can make the best choice for you. All right, now switching over to the topic of compensation, because one major drawback of residency programs is the drastic difference in income when compared to working in private practice. ZipRecruiter lists the average salary of a GPR resident at $48,116, which is about $23 an hour. The homie running the Dunkin' Donuts downstairs in my apartment makes about that much. Heck, the assistant that's holding your suction at your local residency is probably in that ballpark. Okay, now we all know that the average salary of a general dentist in their first year after graduation is quite modest, coming in at a median salary of around $160,000. Guys, this is over $100,000 in income potential difference. I was almost able to make double the median salary without a residency. So take these averages and medians as ballpark estimates. If you want to earn a lot, you definitely can as a dentist, and you may not need that extra year of training. While I get the appeal of additional education in a structured environment, I'd like to point out that those who are advocating for a GPR may not have your financial well-being as their top priority. At some point, it's crucial to take control and make decisions that align with your best interest. Considering the increasing student loan debt and the ridiculous interest rates these days, the opportunity cost of a residency program that does not guarantee advanced education simply may not be the right thing to do for you as a new grad. If you are set on residency, great, I support you. But please carefully evaluate each program, as choosing the wrong program can result in significant losses. Not every program is the same. Some are phenomenal and others are regarded as a fifth year of dental school, with program descriptions often being similar and accreditation requirements being standard throughout. Determining which programs are worthwhile can be quite challenging. They literally all sound the same. So it's kind of like picking between dental schools. It's not that easy to discern which is the best program for you. It's important to note that your salary as a general dentist will depend on various factors, and completing a residency program will not guarantee a higher salary. Although I personally have not completed an AEGD or a GPR residency, I have a ton of friends who have. And from a financial perspective and from what they tell me, I don't believe that it has a significant boost in profitability compared to focusing on private practice from the start. Sure, you may get IV sedation training in residency, and you get to suture facial lacerations in a hospital setting. That all sounds fantastic, but it doesn't mean that you're coming out of residency sedating all your patients on your own, or you're ever gonna see somebody coming into your dental office with a knife wound on their face looking to get a suture. It sounds interesting in theory, but many times has very little practicality to your day-to-day life as a general dentist. But starting in private practice directly allows you to develop speed and confidence in treating and managing patients independently. Private practice or corporate dentistry may be the preferable path for you. And I'm sure these ideas I'm talking about on my platform may attract criticism, but I wish I had another voice in my head besides my own telling me that skipping residency is an okay thing to do at the time. It would have absolutely reduced my insane amounts of anxiety leading up to graduation. Remembering that feeling of uneasiness is one of the main reasons I decided to make this video. And it's to show you that if you decide to skip residency, you will be just fine. You'll have access to a wide array of CE to enhance learning, and as long as you're willing to immediately implement what you've learned from these courses, you will grow. And doing an extra year of training doesn't automatically generate referrals for complex cases typically handled by specialists like endodontists and oral surgeons. And don't forget, insurance companies will not reimburse you at a higher rate just because you completed a one-year residency program. For private practice owners, it's a clear choice to hire a dentist with 1 year of private practice experience over someone who just came out fresh out of a residency program. The practical experience gained through working in a real practice setting holds greater value in the eyes of employers undoubtedly. And then you look at the minimum work experience required for most job positions. First of all, sometimes they ask for ridiculous requirements, but they do ask for a minimum amount of years outside of residency or school, aka work experience. And this is for a reason. The sooner you enter the workforce, the sooner you will gain valuable experience and potentially open your own practice. Okay, let's address the next topic of residency, feeling like a fifth year of dental school. I've heard from classmates that it can feel like an extension of dental school rather than providing a substantial amount of new knowledge and experience. After enduring several years of dental school, many individuals develop a strong desire to move away from the classroom setting. But sometimes the residency programs bring you back into that very same setting. Homework, case presentations, deadlines for assignments. As a licensed doctor, while being on call late into the night, With the really high cost of living these days, you're basically working for free. I don't know how I feel about doing all that. The appeal of handling hospital-based cases or more complex dental procedures through GPR may sound enticing to some. However, it's crucial to consider whether you have the patience and a real desire to work with patients with chronic diseases, individuals with special needs, and those with real big medical emergencies. I have a very clear vision of the type of dentist I wanted to be, and I never saw myself being a dentist whose goal is to work with those types of patients with extensive medical conditions. So I focused on what I was good at and I doubled down. If my patient is very medically compromised, I'm typically referring that patient out to mitigate risk. I want somebody else to manage that case who is way better trained than me. And maybe that's you if you choose to do a residency. And maybe that's why I refer so many of those cases out. Maybe I should have done a residency. The ultimate buzzword every dental student graduating wants to hear. I know, I was in the same situation. Anytime somebody in a job interview would use this word, I was literally hooked. And honestly, sometimes job recruiters misuse this word on purpose to lure in new docs. You can find mentorship anywhere in private practice. There are so many experienced dentists willing to guide and teach new graduates, but it's your job to find those people. Ideally, the best mentor is somebody who's working the same hours as you and is willing to offer to help out when you get stuck. And corporate nowadays pushes mentorship and new doctor training so hard as they know it's what attracts and retains new grads. I've witnessed it firsthand because I have been immersed in an ecosystem like that. It's actually fantastic. You have a big network of people in every specialty to reach out to, older docs of all ages, group chats where people respond immediately. This is all to say that if you're willing to take a little bit of risk, it can pay off big and your growth will catalyze. And I believe immersing yourself in a private practice environment with doctors willing to teach provides a more comprehensive learning experience compared to being handheld in a hospital setting. Mainly because there's a lot of hospital administration politics, similar to the dental school politics that exists. If you know, you know. At least in private practice, you can gain valuable clinical knowledge and insights into how a dental office operates, whereas in a hospital setting, you get zero of that. All right, in conclusion, I know this video will be quite controversial as it goes against conventional wisdom heard around the hallways in dental school. However, I'm here to tell you that you know more than you think, I promise you. And you are more capable than you may feel coming out of school. Everybody has a sense of doubt in their abilities, and it's okay to feel that way. I understand how you may be feeling. I was there not too long ago. I encourage you to consider all your options, and I'm here to support you in any and every decision you decide to make. If you're trying to specialize, a one-year GPR might be an excellent choice for you to get a step closer to your goals. And if you don't feel ready for private practice, a residency can help you really feel more confident in your abilities before you jump into the real world. But it's time we as a collective start to have serious conversations and challenge conventional wisdom taught to us by people who are not going through the same circumstances and will never understand us. Our debts are higher than ever, and it seems the quality of dental education is diminishing year after year after year after year. But we also have more resources readily available to us in a more connected world than any other generation of dentists in the past. And that is our strength. So if you're asking me if I think a GPR or AEGD is worth it in this day and age, my answer is no. And after watching this video, I hope you understand why. I hope this information was able to help you make a more informed decision in your own journey. And if it was, please hit that like button to spread the love. Reach out to me on IG if you have any questions, or if your experience was similar or different to what I mentioned in this video, drop your thoughts in the comments below. I'm curious to see what other people experience with residency after dental school. Are you considering a one-year residency? If you've already done one, tell us how your experience was. We're all dying to know. All right, I'll see y'all in the comments below. Dr. Rana signing off.